Hi guys, am I audible? Let me just invite. Hi Rituraj. Thank you guys. Thank you for joining. Please speak. Yeah, hello. Beach view. Join the live. Hi Misha. So good to see you guys here. Hi Akriti. I can see you. Hi Nitika. If you have supportive family and friends, no, life is sorted. Hi Saurabh. Great. Hi Kaushik. My students are also joining. Hi Alina. Hello everybody. It's great when you know that you've got supportive friends and family and students. Hi Ananya. Good to see you. I don't know why Palak is not able to join. Let's see. Let's try invite. About mental health once again. It's one of the topics that I'm really interested in. Being a teacher who continuously talks to students struggling with hi Viku, struggling with new pressures that they feel when they enter college and before they leave college. Hi Jatin. So it's like everyday things change for them and they really feel mentally pressurized because of so many things. And looking at that thing so closely, I feel that if I can help even a very few number of people with okay, okay, doing that, Viku. He's continuously writing messages. Thank you for joining, love. Thank you so much. Thank you. Uh, So let me see if Palak is here or not, or I am going to invite. Hi Ritesh. Why is not Palak joining? Why is? Hi Abhijit. Hi Palak. Finally, I can see you. Hi. Yeah, same here. See,
So good
people
to see
started
you.
leaving when you were not joining. So hello, and I will just introduce. Hi, Puneet. So I was just telling people how I got interested in mental health. And here we have Upadhyay, who is, so Nitika is saying hi to you as well. Great, great, great. So Palak Upadhyay is a licensed clinical psychologist. That sounds really heavy to me. And she is assistant professor in the Department of Psychiatry at DMC Ludhiana. And she is doing really well. She's helping out students, and she practices all of this on everyday basis. She sees people struggling with mental issues. Welcome, Palak. I would want you a bit before I speak formally. Hi, Palak.
Hi, thank you so much first for inviting me here and giving a wonderful introduction. So, yes, I'm a licensed clinical psychologist. I'm
Yeah.
practicing from last 3 years. So, since I'm working as a clinical psychologist, teaching is the part of it that goes without saying in a medical college. But yes, I am more focused
Mm-hmm.
toward psychological assessments, then clarifying the diagnosis of people struggling with mental health issues for further management, and as well as we are actively working for the psychotherapeutic modules. So in short, you can say as a psychotherapist also I am
Okay.
I'm working in that.
So, a lot of people, when I posted about that we are going to talk about working females and their mental health, this topic, I'm the one who should be, seeking help first. And I'm sure that there are a lot of women working moms, but all working females who, struggle on everyday basis just because of their gender, one, or just because, there is some mental pressure to prove that they are better than others. Others is the other gender. So it's hi Sagar. Thank you for joining. So it's like very very difficult on everyday basis, and being working since college, I have gone through those stages, and I totally understand that how all of us struggle every day. Hi Priyanshi. So what we shall be talking about how women feel, mentally pressurized on everyday basis. They are working or bringing something to the table, right? So we posted a few stories where we were asking people to give us questions and whatever their concerns are. So we got a lot of responses, but we have chosen things that are important. So the first thing I'm interested in this. Hi, Utkarsh. So the first question is, how important is me time? A lot of
That goes that that
yeah,
that
it's
goes
important.
without saying that
Okay.
yes, it is
So,
important. Having WHO even quoted as one of the world's worst mental health index we are having right now. So yes, it is important in the crucial times. It's one of the forms of self care. So we talk about personal hygiene, right? We never talk about mental hygiene.
important.
How to maintain that, right? It's equally important. Again, the me time somewhere gives you the aspect to explore self, who you actually are, how you can not get into the pitfalls, the regular pitfalls which you actually face daily time. So yes, it is important. So there's no definition to me time, right? One wants to watch television, one wants to go for a spa or foot massage. There are different sorts of that. So according to your satisfaction, yes, but yes, there should be a tint of quality me time where if you can have one aspect to your personal
Okay, let's
growth
not talk
would be
about
really
both
lovely.
here, but
That's my
me
take on
time
it.
would
And yes, it is important.
include anything as Palak said, right? Growth would come later. So let's give importance to time. It is not overrated, rather it is underrated. That what is me time? If you speak to people, they would tell you what is me time.
Yes.
It is very
Rather, it's
underrated, right?
meditative
So
sometimes.
having that one cup of coffee all by yourself is
Yeah,
your
and
me time. You can ponder over things. You can, do whatever you
yes,
want to.
yes.
Just shut everything else and be with yourself.
And then comes the part of introspection where you really want to, sometimes have that incubation period, an aha moment, and yes, I want to do this thing. So there's a lot of
Hi,
scope of
Nitasha
many
ma'am.
other.
She also does a lot of mental health things. She posts on Instagram, and if you talk to her, she's a very bubbly person. And if you want to learn about me time, you should go to Natasha I Deliver. She has a page on Facebook as well. Puneet agrees with what Palak you are saying, right? Yeah, she had a question about meditation. We'll be taking that too. So everybody here, me time is very, very important. We should all take it. Me has no definition. It can be anything that gives you, some time with yourself, right? Moving on to the next question.
Self-soothing
I
activity,
really
yes,
like the idea of spa that you gave, Palak. Going for a spa is a very good me time. Okay, moving on. So a lot of people questioned this or have framed one question out of all the things that they were writing to us. Social media affects, right? So people want to know that how do they deal with it? So a lot of people have been asking this, how do you talk about social media and shut social media, because everybody is on social media. So there were random around 6-7 people asking this, that social media is really health. How do I deal with it?
So the digital, in this digital era, all these aspects, they are like double-edged sword. They have positive aspects, they have negative aspects too, and it's like having a coin with two sides. You need to decide where is the boundary, and first you need to do the self-assessment, how vulnerable you are, what overwhelms you, how much overwhelms you, and you need to have somewhere the discipline, right? Excess of everything is bad, for example. So you need to make a schedule so that you don't fall into the trap. And again, time management is there. If you are spending too much time over it, definitely you will, the boundary is very blurred, and you will fall into the another category, maybe of addiction, right? So there's a full-fledged criteria for that addiction also, that the impulse or the urge is too much that you can't control it, and you need to have that access. And unfortunately, we face a lot of adolescents dealing with it. Parents really under pressure, coming with adolescents, females, males, that they are not, they're all the time on social media. They want to be recognized, so they want to take that shortcut path, and they're desperately looking forward to those mediums, so which are high on novelty seeking, yes, but there have to be a boundary somewhere. You need to draw it for yourself, and it varies from person to person.
So time management is the answer to dealing with how social media has an impact on our mental health. That's a great point. So there were some questions coming in. So one of our audience, Jatin Verma, was asking that, is a mental health issue something that will affect my health permanently? How it would over the years have an impact on me. So that's
it depends on which of the conditions.
And I think seeking help is a good strategy,
right? So
if you really feel that,
yes, definitely it is. If you talk about the long-term effect of it, and how disabled you would be in your life, or you want me to rate on it, then I would say it depends on the condition you're facing, right? And what are your coping mechanisms? Maybe yes. Then comes the part of intervention. You need pharmac, non-pharmac help from a psychiatrist and a psychologist. It's a teamwork, yes, but it depends on from one condition to another. And definitely it somewhere impairs your personal functioning, your occupational functioning. That's why you feel it is somewhere hampering my my condition, and you want to talk about
another question on this, that how does external validation always that is required, how do I deal with that? Because it has an impact on my mental health. So even people so would you like to talk about that?
That's a it's a very common question, actually, in these psychotherapeutic sessions, which we, and personally I think I have also explored on these lines a lot. So positive affirmations fall into the same category, or the external validation you look for is okay in which area you're taking and how much you're taking, from whom you're taking, right? If a small child asks, for example, like, Mama, today's function, and how will I perform? That's fine. But if maybe a 45-year-old man is constantly asking for it, maybe it can be overwhelming for the persons around him or her. B, you need to see that you're being dependent on it, on another person's viewpoint, and living your life from another person's viewpoint is not a good idea, I'm sure, right? You're somewhere side of keeping yourself handicapped always to those assurances, which somewhere you can have on your own. And it's better, again, it's better to work on yourself, the self. No, you if you constantly nurture it, these are the things which you will cancel out during the journey. And yes, excess of it is definitely a sign of dependent personality. So you might look into it.
So how do I use those affirmations on everyday basis? For everyday life that I have as a working woman. How should I be using them? Let's say that I can find some positive affirmations on Google, and then what? How do I use them?
Look, I have seen people with whom positive affirmations really don't work, but I want to know where you're applying it and how you're applying it. Like which of the area where you really are applying it. For example, I can do it. Yes, I can do it. I'm going for example, we are doing this session today, and we suddenly, yes, it'll go well. Yes, yes, yes. So the self-talk is something which is entirely a different process, right? But the positive affirmations, sometimes they do fall into the trap of narcissism as well. if I talk about, yes. So there's a full pathological criteria to narcissistic personality disorder. So they tend to use a lot of positive affirmations, but not talking about the clinical population. I want to talk about the normal population. Yes, you can use it. We use it on daily basis. Yes, I want to, being positive about all the outcomes, and having an optimistic viewpoint to many things would organically give you positive.
So there is a question right here from Akriti, who has joined us. She is saying that sometimes it becomes difficult to accept that we have been feeling vulnerable mentally. To be able to deal with it, it is important to accept it in the first place. How to get there with acceptance? That's also for me, because every day you have so many things to do. You feel that something, you're losing it. But accepting would be the first thing.
Yeah. So
how do we get there?
Yeah. So somewhere I would quote the same thing, that emotional hangovers are so common, right? So you had a fight 2 days ago and you resolved it, but you still suffer from the sour aftertaste, right? So, and it spills over your otherwise normal and okay existence. So you need to accommodate that unpleasant feeling and still try to be healthily functioning around.
Yeah, that happens.
Right. So you need to work on the accommodation part. So flexibility is not only about the yoga and the body. Mental flexibility needs to have the important skill set which you need to work on daily basis. So yes, it is going to be there. They're inevitable. They're going to be part of your life. But rationalization is the defense which we keep on utilizing on daily basis, like making alternative shifts to the same thought in a positive way, in the more rationalizing manner.
Okay, and, that's interesting. Yes, looking for alternatives. That helps. That's really helps.
If that helps.
Okay, so coming to the major question, does meditation really help? And this was not one person. Different people asking the same question, that I have been recommended meditation, or people say we should meditate. But one, I do not have focus to meditate. One, two, that really? So Akriti is very happy with your answer. She's replying rationalization. Yes. Yeah, that's important.
Yes. Meditation really helps. Research also shows that it improves your attention, your concentration, and everything. But adding one more thing to it, apply mindfulness. Like staying into the moment and grounding yourself to the moment, that really helps. That would allow yourself to be more calmer and more composed. Do check into the personalities. Recently, like 2 years before, or maybe 2 years before, I met a person who was meditation or the relaxation exercises were not working for that person. So that, yes, uh, they their mechanism goes against the relaxation. That makes them more hyper, and that makes them more
Yeah.
full of palpitations. So look forward to it, look into that area as well. So yoga and meditation
I
is
also
actually
know
not
some
for them.
person.
So
Yeah.
there is a very small section. Yes, there is a very small section that deals with it. And I remember the first session we introduced, you know, full-fledged Jacobson progressive muscular relaxation, JPMR, and we thought that it's going to work on her. We are sure. She was cognitive, really sophisticated, and she was a bureaucrat, and I mean that's going to work. But when she came back, she was more vulnerable, and she was full of anxiety. And then we got to know, yes, there is something, that's not working in her
Okay.
favor, and their mindfulness actually worked
So
in,
how do we
in her
practice
favor.
that?
Yes.
As in, we all know, meditation ke liye what we're supposed to do. But what about mindfulness? How to do that? As in,
It has steps. I would
okay.
say, seek professional help. There are steps to it. Being in just I would let you know that being aware about all the
Hmm.
sensory experiences you're having in a moment. Like if we both are talking to each other, we are canceling out all the
Yeah.
noises surrounding in the surrounding. We are not paying consciously attention to whatever is happening, right? The noise of the fan or the light, or maybe banging on the door, and how the book has fallen down. I have extremely very consciously cancelled it out in a
Yeah.
moment. So so yes, being very very mindful about the moment, and the grounding is
I
the word
think I think
which you actually
a
practice.
lot of people would now understand that if even meditation is not really helping them out, they need to go to therapy. They really need medical help. And in the culture that we live in the societal system that we are in, it's not very easy for anybody, let alone women, for anybody to accept that they want to go to therapy, or they would need help with that. So we are at a backstage, and we need to bring in this awareness that if you really are struggling with your uh, health, mental health, you need.
Yeah, it has clearly reflected into the mental health index as well. That's We are having one of the world's worst mental health index, and
Yeah.
that's
Because
really
you
sad.
are also
Yes.
a researcher, Palak, I would want you to share some data that you have regarding mental health of India and mental health of women in India, something of that sort, isn't it? That would be interesting to know, because though I'm interested in mental health, but I'm not a researcher in that field, so I don't know a lot of things, right? So I don't know if you have some data. Would you like to share with us? Yeah.
Yeah. Like we were going through a data while we were doing research on regarding
Hmm.
COVID times, how
Okay.
women have gone back to work, because somewhere they have faced you know
Hmm.
a diverse income issue, and actually the realities of life has hit
Okay.
them when they were actually working from home. And
Hmm.
majority of about 50%, there was this
Okay.
Harvard Business Review, the article I was reading at the day, has quoted that 50% of the females, they don't
Hmm.
want to go back to their work. Why? Because of the
Oh
less
my
support
God.
system they
Okay.
actually faced. And 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 it has actually somewhere hit their self-esteem in the manner that what they are actually bringing out on the
Absolutely.
table is not that significant, right? I Females are not actually being crucially equal in terms of earning money. They are always being considered as some supplementary, right, to the livelihood. And I was other day I was talking to a person who was saying that, talking about all the women empowerment and the urban mobility we have better access to technology and everything, but still uh, working females somewhere have to answer that why they need to work.
So I would totally agree with that. Totally agree with
What's
that.
the use? And yeah, why do you want to work? Why do you need to work? You have got the basic education or whatever you wanted to. So the dilemma you are actually dealing with is the predisposing factor to the mental health issues. Then comes the part precipitating factors in terms of working conditions, and workload bahut zyada hai, maybe I am emotionally more vulnerable, but the foundation stone is actually that you are constantly proving yourself every day that yes, I'm crucially equal on the table, and what I'm earning is actually equal. So I was reading that article. I'll share it with you. It was really interesting, and I could see the application part of it in terms of while I was practicing. So that was
Article, and I'll
actually
share it on
which I wanted to share.
stories so that people can go through it as well. It's really, I shouldn't say it is sad,
Yeah.
but that's the hard reality, right? That we struggle with all of these things on everyday basis. Thank you, Utkarsh, for saying that. Thank you, Akriti. And yeah, Puneet agrees with whatever Palak is saying. Great, great. So, okay, there is a very, very personal question coming in, which says that how can I stop comparing myself to my friends and cousins? Very interesting.
It's I would definitely want to
Mm-hmm.
answer this question
Yeah,
in
sure,
two
sure,
ways,
sure.
if you allow
Interesting
me.
question.
That first, yeah. So, firstly, you can't do it. Why? There's a technicality to it that you will never compare two different flowers in the same garden because of their different characteristics, because of their different soil preferences, different colors. Some are indoor plants, some are outdoor plants, right? So similarly, if I take example, and if you allow me, I'll take your example. You being Sonam, you have different roles to play. You're a daughter, then you were a student, then you're a sister as well. You're an employee, then you're a wife, then your mother, your daughter-in-law, you're a friend. So all these affiliation has made you today what you are. Similarly, I have been raised by different set of parents. I have a different partner. I have different working conditions. I am also into sisterhood to a different personality, right? So all these affiliation has made me what I am today. So I have been nurtured in a very different environment. You have been nurtured in a very different environment, and it will be very, I would say, ruthless or maybe not being justified to compare two different flowers. No, sunflower and gulab ka phool are not the same. Are not the same, right? Usko you use it in puja part always, right? And they have their own significance to it. So yes, now you want to stop the comparison. So why you want to stop the comparison? Because somewhere you have that tint of self-shaming. You need to work on that. If you're shaming yourself
This is such an eye opener.
while doing that comparison,
This is totally
that's
an
where you
eye
want to stop
opener.
it. That's where you want to stop it. Yes, that's where you want to stop it. No. So you need to acknowledge your personal and professional growth first. Practice gratitude to the core, whatever you're having, and allow yourself to be on a journey, and to explore things what are meant for you. And everybody is hence on their own journey. So it will not be, it's very punishing on your part to compare actually to a very different being or entity. So yes, and apart from that, if you still, if the person is not convinced with that, I would say go and read a book, if that might help. So it's a wonderful book, like uh, How to Stubbornly Refuse to Make Yourself Miserable. It's by Albert Ellis. It's a wonderful book. I have recommended it to many of my clients, and the ones who are very difficult to be convinced that they are actually, punishing themselves. But yes, they were somewhere convinced. It's by Albert Ellis. So a great book. I would definitely share the link with you. So stop stubbornly, you have to stubbornly refuse yourself to make
yourself
we talk
about, so many things that stop shaming this, stop shaming that, normalize this, normalize that, and then we compare ourselves to others. And it's not, though this question came in from somebody else, but I myself, sometimes I compare myself to my colleagues, to my friends, not exactly cousins, but because you have a different relation with them, but definitely with friends and colleagues, you continuously compare. And thank you, Palak, for that wonderful example that really hit us. Right, yeah. Why couldn't I think like that? Akriti, now you are thinking on these lines there, right? Okay, this is before we go on to the final question, Palak. I would also want to know from you that since you deal with your, these, I don't know if they're called patients or not, when you deal with people struggling with mental issues, what kind of strategies you formulate before meeting them? As in, is there a process wherein you get to know something about them beforehand, or is it with the first conversation that you have with them that you get to know that, okay, these are the strategies that we need to formulate? How it is. I would just like to understand the process a little.
So there's a hierarchy to be followed. One, starting with first, we try to assess the patient on different lines. So like what all the personality he or she is. Then there's a different test. Then I am always intrigued to know what are the coping strategies being applied. So there's a test to it, which we call brief cope test. So actively, what all the coping mechanisms you are applying in daily life, I would have a reflection of that. Then as many tests I want, maybe I want to know how much resilient you are. So many a times it's like you tell something which is very subjective, but I need to have an objective basis to it, because I'm bound to work with your mental health, and I have to be more objective in my approach. So then, keeping all those things in mind, we then formulate the psychotherapeutic strategy, which has some short-term goals, then some long-term goals, and which of the strategy is going to help you is always tailor-made. Most of the times we use CBT, cognitive behavior therapy, but not with every patient. It depends from client to client, patient to patient, and sometimes we definitely run an eclectic approach, mix of all.
Yeah, so one kind of strategy doesn't work with everybody. So you do individual analysis, and on the basis of those analysis.
For example, if I deal with generalized anxiety, my first line would be cognitive behavior therapy. I would assess what are the cognitive distortions he or she is carrying. Cognitive distortions are maladaptive thinking pattern.
Yeah.
Maybe you see things in only black and white. I need to assess that. Maybe you filter out all the positives and you only think about the negatives. Maybe you're carrying the rewards fallacy. The rewards fallacy is, since I do good to people, therefore good should happen to me.
Most of us
that's actually not
would fall in that category, Palak. Most of us. I have seen, not just myself doing that. I've seen my parents, a lot of my elders, as in the family do that,
we have been strategically taught that. I can see.
मैंने जिंदगी भर अच्छा किया है, मेरे साथ ऐसा क्यों हो रहा है, right? And I sometimes say that to myself also.
यार ये तो फिर एक स्कोप है. You are तो still giving that scope. कई लोग तो बोलते हैं हमने अच्छा किया, हमने कुछ बुरा किया नहीं है तो हमारे साथ कुछ बुरा होगा ही नहीं. And
Yeah.
So that's another population. Then you have to bring insight into their cognition that no, something is wrong there. We need to change it, and we need to operate between oughts. Uh, like we should operate in what is actually happening and not in shoulds and oughts. ऐसा होता है,
Yeah.
ऐसा होना चाहिए, क्या हो रहा है, look into that. So that
Yes,
is more
I
important.
agree
Staying
with
in the
that.
present and
I agree with that.
having
Puneet is saying we have been
problem-solving
conditioned
skills.
to it. True that. True that. We have been conditioned in that way, and that is why we think like that. Totally. Okay, this is our final question, Palak. The question is how to tell people to mind their own business in a very gentle manner. Though the question had, the kind of language that was used. So, very strongly when you feel that, people are poking their nose
Yeah.
in my business or my personal life or, you know, um entering my territory or entering my boundaries or breaking those. So how do I
Trying to
tell
be
them
nosy.
to mind their own business? Yeah, politely. Is there a way that I can do that
Okay.
without, so that my
Um,
mental health does not get affected simply because of that?
yeah. So I want to know in which hierarchy that person falls,
Acha.
whether that
Acha.
person is senior or junior.
Yeah.
Right. Yes. So if the person is senior, I would say not to have a double bind communication. Try to be polite and make a request. Maybe you're not liking it and it's a little unpleasant to you. Then being assertive about it, that I am not liking it somewhere. And if the person is junior, I would say take help of humor, because humor is a mature defense mechanism, but be very cautious not being sarcastic about it. So since the question has a gentle manner, I would say it has technicality to it. Learn the difference between humor and sarcasm and apply humor. And maybe the junior would not get offended at the same time, but would be able to maybe get the point that yes,
We
maybe
all need to learn how to
she's
use
not okay with
humor.
it.
Really,
Let's move on to the another.
even as a teacher, I sometimes feel that students cross that boundary and reach out to you in a different manner. So a lot of times I'm like, let's not reply to this person. Okay, let's just ignore that he did this or she did that. But ignoring is not an answer to it, because that would mean that okay, maybe I can do that again. So very interesting that humor can be used. Not sarcasm, but yes, humor can be used.
Yes, yes. Give them humorous examples how the other person was treated in a different in a similar situation. But I have not done
Yes,
that,
yes.
and you should be
That can
thankful.
be done. That can be done.
Maybe
Acha,
that
Palak,
will help.
one last thing that we all wanted to know from you is that are you only working or helping people who come to your hospital, as in DMC Ludhiana, or can we seek help from you online? Can people reach out to you on your Instagram or maybe on some other platform if you want to? Are you open for helping people via online sessions? If you are comfortable, do let us know.
Yes, so my hospital definitely has provided me
Oh,
a platform of online
great, great.
therapy sessions. You can you can mail me. I can give you my email ID. You can mail me. Then you can have
Okay.
an enrollment
Okay.
number in the hospital, maybe, and
Sessions.
we can have confidential sessions in a way which uh,
Yeah, so Akriti also wanted to ask you the
helps you
same question,
in your mental health.
right? Because talking to you has been a real pleasure. Even I have learned so many things, and for all of us who are working and trying to balance life, it's not easy. It really affects our mental health, and when people feel that whatever we are doing is not significant, as the research says, that really breaks my heart. That really breaks my heart. And we would really want to, access the knowledge that you have, the experience that you have. and maybe somebody would really come out of the pit that they have fallen in. Thank you, Palak. Thank you for joining this session and helping out us. And I would really want you. I
Thank you.
have her email ID,
Thank you
guys.
so much for
I have her
putting me
email
on the
ID, so I am going to post it on the IGTV that I post after this session, and all of you can reach out to her via email ID. You can also DM to me. Thank you, Vansh, for joining in and enjoying the session. He says very informative. Thank you. So, thank you, Palak. Thank you so much. It was real fun having you and really increased
Thank
what
you
we
so
know
much,
about
Sujata.
mental
Thank
health.
you.
Hope to do another session with you, Palak Part 2. So I hope we can find more topics related to
Thank
mental
you.
health
Thank you.
during this whole September month, which is the month for self-care. I would really want to do one more session, and let's see if we can have Palak again or we will have to seek somebody else. Thank you, Tanusha. I think Saurabh is
Thank
also
you.
commenting, Palak.
Um,
Yeah. So thank you everybody. I'm closing the session. Thank you, Palak. Thank you so
Thank
much.
you so much.
All the love to you. Bye bye.
Bye.